Next, we move to the third group of the treatment, knee osteoarthritis, which is surgery. Surgery can be divided into arthroscopic debridement, means we put scope inside the knee joint and debride the inflamed synovium. Normally, we don't do this procedure as a standard procedure unless you suspect the pain due to the degenerative meniscus tear, and then we go inside, look at the meniscus and remove the meniscus. This will improve the patient's symptom. Or some patient, based on my experience, when we put scope inside the knee joint, we can see a foreign body or loose body which is originated from the bone spur or fracture, detached and goes inside the knee joint. It will produce symptoms, which is pain for the patient. But this condition is very rare. I only see one patient have this problem in my practice. Next treatment will be injections. Or have you heard about viscose supplement injection or hyaluronic acid injection? The purpose of injection is to relieve the pain by improved lubrication across the knee joint, and by improving the pain score, the patient will feel better and there will be less indication or less consumption of painkiller, hence to reduce the side effects of the painkiller. This is the function of the viscose supplement. My take-home message for you all: if you need injection, kindly get a high molecular weight injection over the knee joint. And viscose supplement injection, normally it will do better in a grade 2 or grade 3 knee osteoarthritis. For grade 4, it is unlikely to give a significant result. Some patients ask me about PRP or platelet-rich plasma. Platelet-rich plasma is a treatment where you draw a blood from the human body, spin within 10 minutes and get the platelet-rich plasma. Platelet-rich plasma contain high concentration of growth factor for tissue healing. Normally, for knee joint, there is no conclusive evidence this PRP will do better or to improve the cartilage condition. I repeat, at the moment, based on current evidence, PRP is inconclusive for the treatment of knee osteoarthritis. Normally, we use PRP for a localized small cartilage defect to stimulate their cartilage regeneration. However, for knee osteoarthritis has a limited indication, and at the moment, the indication is case-to-case basis. So you may have to discuss with your doctor regarding to receive PRP injection. If the person have a grade 3 knee osteoarthritis or almost grade 4 in a young patient 54 years old, we give option of knee osteotomy or surgical, we call realignment osteotomy. This is to correct the alignment by performing osteotomy of the bone, cut the bone, correct the alignment, and then put a plate. By correcting the alignment, the patient will have a better axis and will have a reduction of pain. And after that, the patient will be followed up periodically at certain interval to look for evidence of deteriorating of the knee joint. If the condition become worse, then we may embark on knee total replacement at the age of 60 years old. Joint replacement can be either unicompartmental or totally replacement. This treatment is safe, minimal complication, and it is a common procedure in Malaysia today. Total knee arthroplasty, the main aim is to replace the worn cartilage by providing reduction in pain score, improve quality of life, and improve function, and correct the deformity. As I mentioned earlier, knee joint osteoarthritis, some patients may have a bow knee due to the genovirus. By performing arthroplasty, it has ability to correct the deformity. Again, arthroplasty can improve the pain or relieve the pain, improve the alignment or correct the deformity, and improve activity, daily living or function of the patient. And of course, there are complications related to the procedure. However, complication is minimal. Complications are infections, which is 1 to 2%, ligament injuries is 0.5%, deep vein thrombosis 2-3%, neurovascular injury or cut the popliteal artery or common peroneal nerve. But this is very rare, which is 0.05%, iatrogenic fractures or fractures during cutting of the bone, because some patients may have a weak bone or osteoporotic bone when they undergo this procedure. However, this complication is very little. For knee arthroplasty, there's a two component of the knee arthroplasty. You can see there'll be a femoral component, the tibia component, and the polyethylene in between. There are many types of implant related to knee arthroplasty, and the surgeon will discuss with you based on which implant you are suitable for. Again, also the choice of implant depends on the surgeon preference and training. To me, based on the current literature or practice, we consider 60-year-old and above to undergo arthroplasty or total knee replacement. However, this is for case-to-case basis. And last but not least, I want to bring the term of radiofrequency or RF ablation of the nerve that supply the knee joint. What is the indication? Indication is just for pain management and then to bridge the non-operative treatment to a surgery. This is indicated for young young patient which is not ready for total knee replacement, or the patient don't want or refuse to undergo for any surgery, I will offer radiofrequency. For example, the patient at 55 years old, an indication for knee arthroplasty is 60 years old. There's a 5 years gap. Now he refused to undergo any surgery. Then I need to escalate my treatment modalities. That's why I offer radiofrequency. What is radiofrequency? Radiofrequency involves ablation or cutting the nerve using laser. There are 4 main nerves that supply the knee joint. We will block only 3 above. The fibula or peroneal nerve we will not block because it will cause a paralysis. We only block the nerve, the sensory nerve that supply the knee joint, by putting a probe or needle during the procedure guided by the x-ray, and then we will burn the nerve. It will improve or cut off the pain nerve supply to the arthritic joint, and then the patient can continue with their normal activity, daily living. And again, remember, the patient will experience the pain again at average 6 months to 1 year because the nerve will have ability to regrow. And the good about these modalities is it can improve the pain, no surgical intervention. It can buy time for the patient for definitive surgery, which is total knee replacement or knee arthroplasty, or also indicated for a patient which is not fit to undergo surgery but wish to have a prolonged pain relief treatment. Also, patient which is totally refused for knee arthroplasty but they wish to have a better pain control. Then we may offer radiofrequency. Thank you.